You're listening to Vancouver Co-op Radio, CFRO 100.5 FM. We're coming to you from the unceded traditional territories of the Squamish, Musqueam, and Tsleil-Waututh Nations around Vancouver, BC. I'm your host, Bernadine Fox, and this is the show that dares to change how we think about mental health. Welcome to Rethreading Madness.
When I've never been further, knowing what the hell I'm gonna do. When I can't seem to find my way, under or over or through.
You're listening to Rethreading Madness on Vancouver Co-op Radio, CFRO 100.5 FM. I'm Bernadine Fox. And today I'm doing a program on consent. And so I'm going to start with a trigger warning that we are going to be talking about therapy abuse, sexual assault, and what is consent. So some of this material may be very difficult, and we ask that you do what you need to take care of yourself. In this hour, we're going to look at what is consent between two adults. And in particular, when is yes not a yes? I know we often like things in tight, neat boxes with clear delineations of what is right and wrong, but the issue of therapy abuse demands that we look closer at the issue of consent. By the end of this program, you will understand why it is important for us to do this. We also discuss BC's new Health Profession and Occupation Act, regulating our doctors and health professionals, but please know it has been revised, and from what we quote here. And at the end of this program, I will give you the revised section. So stay tuned. Listen to the end so you make sure to get the revision, and we'll be right back.
Tanuyap, Quiget Yuans Quiansna. Hi everybody, my name is Quiget Yuans. I'm a member of the Squamish Nation and the Yagalanis clan of the Haida Nation. You're listening to Co-op Radio, CFRO 100.5 FM. We live, work, play, and broadcast from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations.
You're listening to Rethreading Madness on Vancouver Co-op Radio, CFRO 100.5 FM. I'm Bernadine Fox, and right now I'm chatting with Amy Nordhus, who's been on our program before talking about therapy abuse, and I brought her back to talk about specifically about the issue of consent and the confusion that clients end up in when they've been groomed to believe that they consented, that this is their fault, that they want this. And I'm very grateful for Amy to coming back and chatting with me about this. So welcome back, Amy.
Thank you for having me. I'm glad to be here.
Perhaps for our viewers, you could give them a very brief synopsis of what happened to you.
Sure. About 10 years ago, I was in Celebrate Recovery at my church, and this therapist was recommended, and I'd always struggled with depression, and I'd had childhood sexual abuse. I wanted to be a better parent. I wanted to strengthen my marriage. And so I thought, yeah, I'd love to give him a try. And I found out he was an elder at this church. So I thought I had this Christian mentor and therapist, and he was also a psychiatrist who could oversee my medications. So I start seeing him, and pretty quickly he becomes kind of a father figure for me, and I end up getting really attached to him in that regard. And I just felt like he was this safe, just this safe male in my life.
Mm-hmm.
Ironically, he was grooming me this whole time, and eventually sexually assaults me. And I just felt very bonded to this person who, I could see was hurting me. I eventually am able to tell and get away, and I file a civil suit and report him to the medical board.
Mm-hmm.
So that is with this issue of consent, it was so baffling to me why I was allowing these sexual acts that I didn't want to be doing. So why was I doing it the first time, and why did it take me a while to leave? And it took me years to untangle all of that, and to recognize that I was a victim, and to recognize what consent really was in that situation.
So when you were in the,
Go ahead.
So when you were in the midst of it, when you're sort of grappling with what's going on, and you talk about having a father figure, it's somebody who was safe, and then this other stuff is happening, and he's groomed you, and this begins happening, the sexual assault begins happening. Did you see it as an assault?
The first time I did,
Okay.
I just absolutely crumbled and was sobbing uncontrollably and saying, I can't believe you did this to me. I can't believe you did this to me. And I didn't think I would survive it. And I honestly didn't think I would go back. But you know what? He had gotten me so isolated and he had made me feel that maybe I had some role in it happening that I was too afraid to tell. So if I didn't have anybody else to go to, who did I have? And I went running back to him.
Mm-hmm.
So he then was comforter slash abuser.
Right.
So I decided it was an accident and it would never happen again. And I went back.
Mm-hmm.
Um, so yeah, at first I did. And sadly, I couldn't leave.
So as it was continuing on, did you still see it as not something you were consenting to and that you just couldn't leave?
Well, there was a time period in between where he had to, back off
Mm-hmm.
and kind of work on the grooming again and work on
Right.
getting me attached again. And I want to say it was about from May, it was about 2 months later that he started up again. And at that point, I knew that I wasn't saying yes to what was happening, but I also knew that I was saying yes to the connection or the attachment.
Right.
And it was just utterly confusing.
Mm-hmm.
And
Yeah,
I also
absolutely
kept
confusing.
thinking that if I made him see that he was hurting me, he would stop because I thought that his actions were coming from a loving place because I never could even fathom that level of evil, that
Mm-hmm.
all of that had been,
Mm-hmm.
manipulation.
Did he make you feel like you were responsible for his well-being or what he
Oh,
understood or
yes.
didn't understand? So the role
Yes.
reversal had been complete by that point.
Yes. He
Yes.
had made me feel indebted by stopping charging me for a while. He had told me it would kill him if I ever left, that we had this, you know, heaven sent connection that he'd never felt, that he never felt loved, that he never had romantic feelings for his wife, that he, just on and on, how fragile he was. He even told me at one point he wished that I was his mom.
Mm.
Um, and yes, I saw him as this sad little boy in an adult body. And it's kind of like my maternal instincts kind of kicked in. And I thought, I can't leave him. He said it would kill him if I ever left. And even
Hmm.
though he's hurting me, didn't he help me before? So after all he's done, how can I, it was just,
And so, hard question. After it started happening again, do you think there was anything in what you said or did that would make it clear to him that you did not want this to happen, or did you feel like you couldn't do those things?
um, after it happened, I just sort of went through the motions this first session at the
Hmm.
end.
Hmm.
And I went through the motions and just left. And when I came back the next session, I was crying and I told him that it made me feel like a prostitute and he didn't even leave time to talk to me at the end and that I couldn't do this and this was killing me. So yes, I did voice my concerns, but was I able to just get up and leave? No.
No.
That's what's so strange is that I still felt like I can't leave, so I've got to fix this. I need whatever this thing is that what I need this father figure, this safe place that he had pretended to give me so badly that I was able to keep giving him another chance and another chance.
Did you fear rejecting him
Yes.
in his
And
advances? Yes.
yes,
Yeah.
because I felt like, he had made me feel indebted in a lot of ways. He gave me longer sessions, 3-hour sessions,
Hmm.
um, special treatment, not charging me. And I felt like I owed him a bit. And I felt like kind of that feeling of like, well, everything he's done for me, and he's never felt love. So I guess would it kill me just to, you know what I mean? Kind of give a little bit back to him after all he did for me, even though it wasn't what I wanted to do.
No, I get that. And honestly, I'm hearing you, the words you're saying and how you're describing it and how almost benign it sounds, but very aware that what you're describing is sexual assault. And ultimately, it was very, very damaging to you.
Yeah, and at the time, I think I was so confused.
Mm-hmm.
I didn't even know which way was up. It took me a while to get out and get away from it to even realize that I had been manipulated.
Right.
I thought he had been good to me and kind to me and generous to me. And then at the end, he started to take advantage of me. It took me a long time to realize the abuse started on day one when I went in for the first appointment and he pretended to get a blanket out of his cupboard and pretended to match it to what I was wearing and then kind of playfully covered me up with it. Well, he was coming into my physical space on day one.
Right.
Yeah.
And it sounds like, and you can correct me if I'm wrong, that the specialness and the caring and the father figure and being the safe person was a part of the grooming that left you in a very untenable position when the assault started happening.
Oh, right. And when when they uncover these, deep-seated voids that we have that maybe we don't even recognize that we have,
Mm-hmm.
and they start to fill them, it feels like a drug and it feels like you need it.
Yeah.
Whatever this it is, you need to go back. And they can't make a move until they get you to that place. Once they have you addicted and isolated and questioning your role a little bit and indebted, they have to kind of have check all those boxes, then they can start to up the ante.
Yeah. And when you say addicted, you're not talking about a drug necessarily. You're talking about addicted to what they're offering to you.
Yeah, just if it's the father figure, or if it's a
Yeah.
need for attachment, or if it's
Yeah.
a need, or if it's a partner. For me, it was a father figure. Um,
It's so sad on some level, and it sort of betrays, or not betrays, what is it describes the exploitation so clearly and the imbalance of power and authority so clearly, in that what you're describing is having a father figure, and that you were sexually abused as a child. And so being sexually assaulted, not necessarily, I don't know if your father assaulted you, but assaulted in this capacity could end up for you feeling normal, like what was happening was normal.
yeah, or maybe a price you pay for
Oh,
connection. I don't know.
yeah,
I'm just sort of throwing that out there
yeah.
for those
I've
of
heard
us
that
that
from other
have that.
people. Yeah.
Yeah, it's like for me at the time, I remember not wanting to do it, but thinking, well, just do a little for him. Like I
Hmm.
remember before it became like sexual, he had said, you could kiss me on the lips if you want to. And I just looked at him like, what? And I just left the session like, okay, I'll keep that in mind. And then I started feeling so bad for him. And I was like, he wouldn't have brought that up if he didn't need that. And it's not, I didn't think it was sexual and I didn't think it was creepy. And I thought, would it kill you just to do that? Would it kill you just to give him a quick peck on the cheek? And it was like I made myself, like I owed him somehow. So
If you had
yeah,
felt like you could just say no, would you have gone along with those things?
that's the question. Why couldn't I just say no? Um,
But you're
no,
saying that you didn't feel
no,
like you could say no.
I didn't think that I
Yeah.
could say no. And it was, and there were so many reasons why, for fear of hurting him, fear of losing the connection,
Right.
um, feeling, that low self-worth piece that I don't deserve love. And so, maybe I have to work a little harder for it.
Well, you have to pay
Um,
for it in some
yeah,
capacity.
maybe.
Yeah.
And so, yeah, sorry,
Yeah.
I don't think I addressed that question very well, but
Actually, you did that very, very well.
okay.
Very clear, Amy, and speaks to what you're grappling with as a client when your therapist, who is in the know, who does understand what they're doing, who does understand that they're doing wrong things, is grooming and then exploiting and using confusion to exploit further their client who is in pain and needs them and needs something from them. And they're using that to get their needs met. and in a way that has nothing to do with your best interest or your well-being.
Right.
It really did describe that confusion that people go through, wondering, is this my fault? Did I agree to this? Did I not agree to this? Did I, maybe I was too nice. Maybe I wore the wrong
Yes.
clothes. Maybe I'm just, like you said, maybe I'm just being, not giving enough. Maybe I need to do more. All of those things, which honestly, all of those things are therapeutic issues that he should have been working with for you to help you come out of the confusion, and not using them to create more confusion to get what he wanted and to
Right.
exploit you. So
And
you
for me, I felt like this happened to me because I'm too needy, because I need a parent figure, and which makes me a loser. And because I was so needy, I got so attached to him, which made him get so attached to me in kind of a father-daughter way. So meaning, even though he crossed the line in an egregious way, I felt like almost like the attachment was my fault, or that I led him into it that way. And I mean, I did not dress seductively at all. He's the one who pointed out that I dressed like a tomboy. But it was just always thinking there's something wrong with me.
right.
Whatever that something is what caused this. There's something defective in me, and it's broken, and that's why you're in this mess.
Right.
So yeah. And they know that. They know
They
that
do.
about yourself. Therefore, they know they have a free pass. They know that you're probably not going to tell on them, because you
'Cause
first will attack yourself.
Yeah, exactly.
Yeah.
You've
And
described it.
also, I wanted to say that to say no to the sexual advances at the end felt like saying no to the relationship. And I was saying, yes, I still want this therapeutic bond that I thought we had. That's what I'm saying yes to. And I'm saying, I can get him to stop. He'll stop. If he realizes this is hurting me, he'll stop. So that's what we're saying yes to.
Right. And
We're
did
not
he
saying
stop?
yes. No.
No.
It took me, I think I went maybe 3 more times and begging him to stop. And at my very last session, just crying and saying, I can't do this anymore. This is hurting me. And this is so pitiful. I hate even saying it out loud, but I remember saying, could we just please leave clothes on and talk? Will you just talk to me? I'm begging my therapist to just talk to me,
Yeah.
which is just pathetic. And he laughed, and I saw the cruelty in that moment. And that's what I really needed to see. I knew, I kind of started to see glimpses of that evil and cruelty, but I just really needed to see it.
Yeah.
And when I saw it, I was able to not go back. Now, did I make myself go through that entire session like a robot? Yes, I did. When I left that day, though, I vowed, isn't that sad? I didn't even have the self-worth to leave right then.
Well, no, but it
I just-
speaks to the level of power and authority that they have, and the level of coercion we feel, that we can't just say no, bold-faced no.
I know.
We have to somehow sneak out the back door. And I've heard that over and over and over and over.
Yeah, and it's like, heaven forbid I'm not polite, or I hurt his feelings, or heaven forbid I make him feel uncomfortable for making me feel uncomfortable.
Right.
So yeah.
Well, Amy, I am so glad you saw that you did whatever you needed to do in that session to get through that particular session, and that you didn't go back. You did say no, and you saved yourself out of that. Thank you for doing that. And thank you for having this conversation with me.
Yes, of course.
Vital conversation. So many people are in that confused place, trying to figure out what they should or shouldn't be doing, and what is their part, and what is their responsibility, and how do they manage to extricate themselves without hurting the person that they've come to care about, which is their therapist. So thank you.
You're welcome.
Do you feel unsafe in your home?
You are not alone.
Transition houses offer free support and shelter for women and children.
We are here for you.
We are here for you.
We are here for you.
Make the call.
1-800-VICTIM-LINK.
1-800-563-0808.
bcsth.ca.
You're listening to Rethreading Madness on Vancouver Co-op Radio, CFRO 100.5 FM. I'm Bernadine Fox, and right now I have brought back somebody who's been on our program before, Amy Avalon. She's a retired therapist who has worked with a number of survivors of therapy abuse. She was also a member of TEL, doing peer support work with folks all over the globe, much as I do. And she also reported a colleague who had transgressed boundaries with a client in regards to therapy abuse. So welcome back, Amy.
Thank you, Bernadine. It's so good to be back.
It really is an important thing to do, that mental health consumers understand the nature of their relationship with their therapist, what is right and what is wrong, and what transgresses boundaries and what they can do about it, and trying to frame some of that stuff that is often nebulous and vague for them. And this show is about consent. And I've come to it because I have become clear in working in trying to communicate with the Minister of Health here and organizations here in not just in Vancouver, but across Canada around the issue of consent. What is consent? And when is it consent and when is it not consent? Because somebody can say yes, but that doesn't mean they were free to say no. And we see this most aptly when we look at it from the perspective of a child molester who is grooming a child. And often what they will do is they will do that grooming in such a way that the child agrees to something or feels pleasure about something and therefore feels that they went along with it, or feels guilty or feels responsible for the welfare of their therapist, and so feels like they have to go along with. And so the notion of this show is about coerced consent and what does that look like. So when when does yes not mean yes? So I was hoping that you could talk to us a little bit about how you see consent.
Well, in the context of, boundary violations in the therapy relationship, and certainly if we're talking about sexual contact of any kind, to me, there really shouldn't even be this discussion about consent, because all it does is distract from the egregious misconduct of the therapist. It should never even get that far that a therapist should be asking any client if it's okay if they proceed beyond the ethical boundaries of the therapeutic relationship. Okay. So that's just where I stand on it. A lot of times you'll hear people say, particularly therapists who are not informed about this issue, they'll say, well, these things happen and, this therapist fell in love, et cetera, et cetera. Well, these things don't just happen. They happen in very tiny transgressions over time. So this isn't just like one day someone realizes that, they need to have a conversation. It's a series of subtle transgressions, even about, it could be, starting to text outside the therapy hour, talking about personal issues. Those things are things that we are trained as therapists to know are not appropriate. Okay. So it really shouldn't even get there. And again, I think this whole issue of consent is really just a way for therapists and their boards to excuse terrible behavior. Okay.
And that's really unfortunate because, when we look at this, what we're talking about, if we just put it on a bottom level, what we're talking about is mental health professionals whose sole function in the world, in their professional capacity, is to help people, help people explore and move beyond and find new ways and new avenues and, achieve their full potential in life. That we're having to talk about something where that is completely off the board. Suddenly we're not talking about what's in the best interest of the client. We're talking about what is in the best interest of the abusive therapist. How can we define consent so that the therapist is released from their ethical guidelines? Is kind of how it looks like to me.
I worked with really wonderful colleagues, and I've certainly appreciated all of my training. And it isn't that we don't care and have complicated feelings towards our clients from time to time. It's just that really good, well-trained therapists know that our feelings are in the context of the therapy, and so they're information for us. They're not signals for us to act on.
Mm-hmm.
And if we find that our judgment is being clouded, we never discuss that with our client. We go to a peer supervisor or a senior supervisor or mentor, and we work that out. And then we decide if it's in the best interest of this client, if we continue to treat, if we can put those feelings aside and realize that they're just, manufactured from whatever is happening in the therapy, or if we need to refer that patient out. So you'd never really have this discussion with your therapist. And this is often how it's reported to us, as you know, is that, well, one day my therapist told me they had feelings for me, or I shared with my therapist that I had feelings for him or her. And the therapist responds, yes, I feel the same way. And it starts from there. So it looks like it's this consensual conversation, but the therapist should never even really go there with their client. And it's not something to work out with the client.
No, I agree. I absolutely agree. If a therapist has feelings for their client in that capacity, the client should never, ever know about it. And they should be either, exactly as you said, either work it out in a way that doesn't impact on the therapy, or refer that client out without ever having told them that was the case.
Absolutely.
It's not theirs to bear. What do you say to clients? Because we hear about this over and over through TEL and through other support groups that I'm involved with, or social media platforms that I'm involved with. You hear over and over people come and say, well, this is my fault. And it's my fault because, I was attracted to them and I seduced them. And so, and they said that, you're going to know exactly what I'm saying here. They said that they've never done this with anybody before, that they broke the boundaries because it was in my best interest. It was therapeutically best for me to do this, and they're risking their career because they did this with me for my benefit, and so this is my fault and I agreed to it. I seduced them. What do you say to those clients?
I would say that it doesn't, because they are the ones who are going to a professionally trained therapist for help, that everything that happens in that therapeutic relationship is the responsibility of the professional, the person that they're paying. So it's never the client's fault. It doesn't matter if they, if they throw themselves at this therapist. The therapist
Audrey said
is the one with the most power. The therapist is the one with the power. The therapist is the one who has been trained to say, no, that this is not in your best interests, and to help the client understand that these feelings are normal, but acting on them is not going to help them. And so it's never, ever, ever, ever. There isn't a single situation where it's the responsibility of the patient. A lot of abuse victims will blame themselves and their own, quote, pathology.
Right.
Well, every single human being on the planet wants to be special, be seen. That's just a normal human trait. It's natural to be that way. And so when the abusive therapist is saying how special they are and they're making this huge exception because of them, that's why it's so abusive, because, that's what all of us are longing for.
Yeah, and the flip side of
that. So to do it in the context of therapy. Yeah, go ahead.
The flip side of that is that when it starts going off the rails, that same therapist who said, oh, you're so special, will now turn on the client and say, well, this isn't working because you're neurotic, because you have mental health challenges. And then so the client is left to bear responsibility for this wonderful thing that was going so wonderful and it was so great not being okay. Can I just ask you sort of, you don't certainly have to come up with an absolute number, but just an estimate. How many clients who have experienced exploitation by their therapist, how many of them fell in love with their therapist? Under the notion of under transference. I want to clarify that, not necessarily falling in love the way the rest of the world does, but because of transference, believe that they had fallen in love. What would you say the percentage is?
Well, I mean, that's an interesting question, because I would say 0%, because they're not falling in love with a person. They're falling in love with a projection. An abusive therapist can essentially do the same thing in that relationship. So, I'm not sure what you were getting at with that
So
question,
let
I
me
would
try
say,
asking the question. I'll ask the question again.
Mhm.
What percentage of clients experience transference to the point that they believe their therapist is an amazing human being?
Oh gosh, the transference is always a given in therapy.
Mhm.
So that would be 100%.
100%. What percentage of therapists, and again, I'm not going to hold you to coming up with the actual source, but what's the percentage of therapists, trained professionals, I guess I should ask, have been warned about transference from clients and about exploiting that transference?
Yeah, 100%.
100%.
That happens from the very first day of training.
And what did they say to you on that first day?
They said just how important it is to realize that the person that you are entering into this relationship with is going to see you in a certain way that likely has nothing to do with you. And you're going to have to really pay attention to that transference and working with it, not giving into it in a way and using it to exploit that client, because they've basically entrusted you with so much that it's our responsibility to constantly be aware of that dynamic and not to personalize it and not to suddenly think we are really all, this incredible person. Yes. To realize that is transference and it has nothing to do with us as an individual.
And in that training, in that discussion, do they talk about the degree of power and authority you have in that
they certainly did in
life?
My training.
So if we look at those two items, the percentage of clients who will experience that overwhelming transference, that their therapist is amazing, and the fact that we know that therapists are trained from day one about transference and the level of power and authority they have over their clients, you put those two together and it really doesn't make any sense that we're talking about consent in the sort of broad scope of society. Why the word consent in that capacity, it doesn't belong there.
No,
without
it's
serious
really
definition.
Yeah, it needs to be completely defined, as you said, but also I just think it's irrelevant to this, to certainly like therapy abuse.
I agree. And I agree that it's not relevant. And the only reason I'm bringing it up is because our Minister of Health here in BC put the issue of consent right straight into our new Health Professions and Occupations Act that regulates psychiatrists and doctors and psychologists and other health professionals, including mental health practitioners. One of the other things we come up with here in the province of BC are organizations and associations that use this clause in their code of ethics about the 2 to 3 year interval between termination and having an intimate relationship with a client. We also have a College of Psychiatrists. Well, it's actually called the College of Physicians and Surgeons and the College of Psychologists, who absolutely, utterly stand behind the never, ever, ever, once a client, always a client, once a therapist, always a therapist. This relationship is the same imbalance of power as between parent and child. And so therefore, at any point, it's lifelong imbalance of power at any point. An intimate relationship is akin to incest. And so trying to go back to those associations that have this 2 or 3 year clause that allows for this after termination, and they have variables in there, that the relationship can't be, such and such. It can't have a therapy that was intense or have to do with, maybe sexual abuse. So therefore it's confusing the issue if you're going to try and have a sexual relationship. But there's no qualifications in terms of who's evaluating those things, and then without that, it comes down to the fact that every one of these associations probably has bad actors in it. We probably have therapists who are using the good name and reputation of an association, but without the ability to qualify every one of those variables, we can't protect the clients from bad actors.
all of these little clauses, really, they're not there to protect the well-being of the client.
No.
They're there to protect the career and potential downfall of these errant therapists who know better. So, because I mean, there's really no situation where you could say, well, I think it'll be really helpful for you if eventually you might be able to have sex with your therapist. That's not a treatment plan. That is, it's just never part of it. Yeah,
predatory therapists would say it's treatment. We have heard that.
Well, of course, but they know they can't write that in their treatment plans.
Right.
They say that to the client,
right,
but they can't write that. There's nothing empirically supported. There's no, none of that is anything that they would put out there publicly.
Right.
All of this is there just to protect the therapist, not to protect the patient.
Right.
And absolutely, I believe 100% should never be an option, no matter how much time has gone by, because I can't tell you how many times people come back 5, 10, 20 years after we've had a really good piece of work and they just need to check in. Maybe they've gone through a divorce or a loss of a parent or a child. That relationship is there for them. And so I'm glad it's never compromised, because it saves a lot of time than them having to start all over with someone else just to have a few sessions with me. Once a therapist, always a therapist. Right. There's a lot of people on the planet. We do not have to be using our clients.
Amy, thank you so much for coming and chatting with me about this. Again, your input is always so very valuable. Thank you.
I'm always happy to help. And thank you for all you do again, Bernadine.
Thank you. Thank you.
Young workers face many challenges today. Unaffordable housing, underpaid and precarious work, and a rapidly changing labor environment. New and young workers are also more likely to be injured on the job. One of the best protections you have as a worker is solidarity. In other words, a strong union. Throughout history, unions have fought for the right to collective bargaining, better wages, benefits and working conditions, protection from abuse by employers, and ending harassment and discrimination at work. For more information on how to join a union, visit bcfed.ca/join.
You're listening to Rethreading Madness on Vancouver Co-op Radio, CFRO 100.5 FM. I'm Bernadine Fox, and right now I have the pleasure of speaking with Audrey Badolis, who's an attorney who's practiced in the area of psychotherapy malpractice for 30 years. She's generally in the New York area and has her own law office of Audrey Badolis. Welcome, Audrey, to the show.
Thank you, Bernadine.
So consent is one of the things that comes up endlessly when we talk with victims of therapy abuse. And it comes up because, like with the child molester who is grooming a child, so often what they do is position that child into a place where they believe they have agreed to this, that they have consented, that they are as at fault or responsible. And so the issue of consent comes up over and over and over. And I have no doubt that you've been dealing with it as well. So I wanted to ask you, other than what I just said about child molesters, what makes sexual contact between a therapist and a client different than with any two other consenting adults?
That's an excellent question. And of course, it's extremely important to the topic. So the very fact that the patients seek help from therapists inserts a level of vulnerability that can upset the balance between the two players right from the start. Mm-hmm. Then you take the revelation of confidential information in the therapy relationship, where the patient's secrets, thoughts, feelings are things that the therapist use to make accurate diagnoses and treatment plans. So the power differential between the two parties is increasing with those revelations. And then you want to look at the element of transference. It is often where the patient will idealize the therapist, who presumably has more knowledge than the patient does concerning the patient's condition. And in those situations, the patients often come to idealize the therapist, or, see the therapist as like godlike, but a lot of times they also believe that they're in love with the therapist. So then you can say, well, the therapist is supposed to use transference as a tool to gain insight into their patient's condition. And the therapists are trained, or should be trained, to recognize transference, and it is their duty to handle it appropriately. However, the bad ones don't. Too many times, the therapist might say, well, you know what? I love you too. And let's hop in the sack. And that's not real consent, because you can't really consent to something that wasn't an arm's length transaction to begin with. Does that make sense?
Yes, and I would add, having been in the position of the client who didn't give consent, is that you can't say no. When you're in therapy and needing this therapist and wanting to please them and wanting to continue on in your therapy, to have your therapist then say, well, I'm in love with you, puts you as the client in the most problematic position you could possibly be in, because now you're faced with rejecting and hurting the feelings of the person you need therapy from. Or, feeling like if you say no, that's going to hurt them and they're going to react. And at least here in BC, somebody who is a mental health professional has an enormous amount of power given to them by the BC Mental Health Act. So it makes it that much more problematic. And this leads, of course, to something I keep hearing from therapist organizations here that say, well, we have this 2-year clause because, if it's been 2 years since termination, then there shouldn't be the same, unequal power. Well, what happens about, the poor therapists? They're not really abusing their client. They just fell in love. It's like they don't go on to think about, well, what happens to the client when their therapist has fallen in love with them? Like, what is that dynamic that happens for the client, which is untenable? It's just simply
it is
untenable.
And I think that it has a lot to do with the concept of boundaries, which I'm sure you've discussed on this program before. The therapist is responsible for maintaining the boundaries in the therapist-patient relationship. And when they don't maintain the boundaries, whether it's by disclosing personal information about themselves to the client or patient, what they're really doing is burdening the patient with their own issues. And so even the most, what seemingly are harmless boundary transgressions or harmless self-disclosures can really be harmful to the client, because the client is burdened by them. And this is why therapists are considered to be fiduciaries to their patients. And they owe their patients an elevated duty of care, more so than, friend.
That fiduciary duty is more because of that position they hold. But it's people like to say, well, I want a friend in a therapist, or I want my partner in a therapist. Well, partners and friends don't have a duty to put themselves aside and act on the best interest of the client at all times.
Yes,
but a therapist does.
A therapist does. And, here in the States anyway, well, here in New York, starting with the criminal statute, which criminalizes sexual contact between therapist and patient. The statute is called lack of consent, and it's an element of every offense defined within that statute, that the sexual act was committed without the consent of the victim. And the statute itself says lack of consent can result from forcible compulsion. That's how we understand rape in its most general term. Or it can result from incapacity to consent. And the statute itself says a person is deemed incapable of consent when he or she is a patient and the actor is a mental health care provider, and the act of sexual contact occurs during a treatment session. Now, that's recognizing that the lack of consent is as if you were forced into it, right?
Because you were.
Because, like you said, putting the onus on the patient to say, oh, yes or no, and agree to it is untenable, because of course the patient is going to agree to it, not to upset the therapist, as you said. And also because in most cases, the patient has been groomed by the therapist into loving the therapist or feeling like they love the therapist, into being emotionally dependent upon the therapist. And so for all these reasons, consent is not something that is able to be given. It's also recognized by the, here in the States, the American Psychiatric Association says that it is never ethical. It is always unethical to have sex with the patient. And you had mentioned the BC 2-year rules. Well, the American Psychological Association here in the States has adopted a 2-year rule, but it basically says that, you know, we can wait 2 years, but you also have to establish that there's no emotional dependency left between the two parties, which I find to be difficult.
So I just want to clarify, our College of Physicians and Surgeons who regulate psychiatrists also say never, never, never. Our College of Psychologists also say never, never, never. It is when we take a step below that to associations and societies that are regulating therapists and counselors who have, some of them, not all of them, and some of them are removing them, gratefully, this 2 to 3 year idea that post termination you can develop a relationship with your client that is intimate, so long as you said. The problem I have with that is, who is determining what the level of power is? Who is determining whether or not that person is still feels that they cannot say no? And the reason that the BC College of Doctors and Physicians and the one for psychologists say this is because they equate the power imbalance between therapist and client as that of parent and child. And they say this is lifelong. So this idea of going to 2 or 3 years is problematic because, like I've said before, it's like giving the keys to the hen house to the wolves. You know, who is determining, who is deciding whether or not that client is capable of entering into this relationship without it being harmful?
Right. And I'd also submit, Bernadine, that what you said about the psychiatrists and psychologists having the, you know, it's never okay rule, yet these other professions having this 2 or 3 year rule, in addition to the problem of who decides whether there is emotional dependence left on the part of the patient, there's the other issue of these people who are practicing psychotherapy are not as well trained, or at least not for as long as it requires training for psychiatrists and psychologists. So sometimes these people who are counselors don't have as much experience or training as the psychologists and the psychiatrists do. So why are they being subjected to, or why do they have looser rules governing them?
And I come down to the bottom line, which is why is there a loophole to have sex with your client? Like, why? Like, what is so, you know, it's like having some romantic delusion about soulmates or something, which of course we know offenders use a lot in this area, you know, that somehow there's an imperative that they must, there's 1,000 million people out there to engage in relationships with. It's not necessary to do it with somebody who's been your client. We've got a new Health Professions and Occupations Act here in BC done by our Minister of Health. And this may be unfair because you don't have the whole thing in front of you, but I want to just read to you one part of this act that it says that I am having a hard time with. And it is Division 1, Section 8, number 3. And it says, a regulated health practitioner commits an act of sexual abuse if the regulated health practitioner engages in an act referred to in subsection 1A, B, or C, which is basically saying you can't have sex or touch or attempt to have sex or touch a client without the patient's or person's consent. whether or not that patient or person is the regulated health practitioner's spouse. I have a real problem with that because nowhere in this bill or new act have they defined what consent is. So there's no provision for understanding that a client may have said yes, but were they capable of saying yes? So I just want to get your, I know you're talking generally, and it certainly is not legal advice, but from your perspective, would you find this a problematic section?
Yes, I would, because exactly for the same reason that you said, which is, what is consent and how do you determine it? And I think that the answer to that is when the person who is subjected to the sexual abuse or sexual contact is a patient, they cannot consent.
So it's like creating a clause that doesn't take into the reality of what that clause is about. If a client can't consent, then this with or without consent is a moot point.
We all know what statutory rape is. We refer to statutory rape as having an actor who's over the age of majority, whatever that is in the particular area, has sexual contact with somebody who's under the age of majority.
Right.
And it's generally accepted that the reason why that is rape, where it was not forcible, right? It's not forcible. It's seemingly consensual, right?
Mm-hmm, mm-hmm.
It's seemingly consensual. But I don't think there's a jurisdiction around which would submit that a child could consent.
No, I agree. And yet here we are, because they see two consenting adults and they don't seem to understand the emotional coercion that goes into therapist-client intimate relationship. And I think part of it is because we live in a society that wants to believe that therapists are doing this work because they are wanting to help people, and they have, they don't have malevolent ideas. They're truly wanting to put their client first and do no harm and do what's in the best interest of their client. And I think that's really hard for that industry to get it, that there are bad actors in that industry that are willing to use that facade of I'm the great guru helping people to actually pluck victims from their client pool and groom them in the way child molesters do.
I think that it's worthwhile to note in the American Psychiatric Association's ethical standards, it says that, the necessary intensity of the treatment relationship may tend to activate sexual and other needs or fantasies on the part of both patient and psychiatrist, while weakening the objectivity necessary for control.
Right.
Additionally, the inherent inequality in the doctor-patient relationship may lead to exploitation of the patient. Sexual activity with a current or former patient is unethical.
Right. And that very lack of objectivity is the thing that I bring up around this idea that after 2 or 3 years, it can be okay. Because this, if you don't have objectivity anymore as the therapist, you cannot decide whether or not this person you want to have sex with is actually okay to do that there isn't going to be an imbalance of power there.
Exactly.
Yeah. Thank you, Audrey. This was a very, very important conversation to have on this issue of consent. And I know so many people who struggle with, like I said, I said yes, so this must be my fault, or I seduced them, or, so somehow they've taken on this idea that they are responsible for the welfare of their therapist. And this has been an important conversation to clarify some of that.
And I say, Bernadine, to the many people I've spoken to over the last 30 years, this is not your fault. I don't care whether you were sitting with the therapist and you stood up from your chair, removed your clothing, went over and sat on the therapist's lap and started kissing him or her. It is the therapist's obligation to say, you must get up from the chair and go get dressed and we need to talk about this.
Yes. Yeah, you're absolutely right. It is always the therapist's responsibility. Thank you, Audrey.
You're welcome.
To quote Tell, the therapy exploitation link line, consent is meaningless unless it's also possible to say no. Coerced consent is a direct contradiction of terms. Yet, this is precisely what is involved in the abuse of a patient by a healthcare professional. End of quote. And of course, all we need to do is a quick read on Stockholm Syndrome to understand how far a perpetrator can coerce their victim into emotional compliance and have them act in ways they would not freely do so. A run-of-the-mill perpetrator can create this in their victims without realizing what they are doing. A mental health professional whose training focuses on the human mind and behavior can easily create this syndrome in their victims. Any loophole, reason, or excuse that allows the therapist to engage a former or current client in an intimate relationship is never in the best interest of that client. It is that simple. Every association or society that provides professional memberships to therapists or counselors needs to review their own ethical guidelines and revise problematic sections that allow for this. Colleges that regulate mental health professionals with the highest level of education have recognized that it is never, ever appropriate to engage in an intimate relationship with one's client and that it will result in terrible damage. Isn't that the bottom line? Do no harm? Why are we giving room for anything that could result in the catastrophic damage we see in survivors? I reached out to the Minister of Health's office regarding the problematic subsection of the HPO Act we discussed in this hour and received back a reply that they have now revised it to include the following. As we discussed in this hour, and I'm going to quote, a regulated health practitioner commits an act of sexual abuse if the regulated health practitioner engages in an act referred to in subsection 1A, B, C, or D without the patient's or person's consent, whether or not that patient or person is the regulated health practitioner's spouse. And that was the problematic subsection. What they've added is, or subsection 1E or 8. It reads like this. A regulated health practitioner commits an act of sexual abuse if, and I'm paraphrasing here, has sexual contact with a client, including touching, intercourse, or attempts to have those things, and here is the addition, manipulates or exploits the patient or person for sexual purposes, including offering and accepting services in exchange for acts of a sexual nature, whether or not the services or health services, and H, builds a relationship of trust or emotional connection with the patient or persons, or uses or attempts to use that relationship to abuse, manipulate, or exploit the patient for sexual purposes. At first glance, it appeared to be the change we needed, and certainly it is indeed a huge step up from their previous version. However, in the Minister of Health's reply, he pointed to a distinction in the HPO Act between sexual abuse and sexual misconduct by a health practitioner, and that difference was dependent on whether or not, again, the client consented, and again, I was unable to find any revision that defined consent or coerced consent, although their revisions seem to imply it. Where this impacts, as his letter outlined, is in how these complaints will be adjudicated. According to his letter, it seems to be a subjective one that hinges on whether or not the client consented. And again, no definition of consent is provided. And while he assured me the penalty may well be the same regardless of consent, it is asking us, survivors, to trust governmental, institutional, or social systems that have historically ignored victims of therapy abuse or made us responsible for the actions of our perpetrators and rapists. So for now, I'm withholding judgment as to how this HPO Act will protect the public from exploitive therapists. Of course, Rethreading Madness extends an invitation to the Minister's office to come on here and correct this if I have construed the meaning of the Act or any one of its subsections. And that's our show. My thanks to survivor Amy Nordhus, retired therapist Amy Avalon, and solicitor Audrey Bedelis for their time and expertise in talking about consent around the issue of therapy abuse. Music today was by Sherry Ulrich, and as always, our thanks goes out to you for joining us today. Stay safe out there.
You've just listened to Rethreading Madness, where we dare to change how we think about mental health. We air live on Vancouver Co-op Radio, CFRO 100.5 FM, every Tuesday at 5 p.m. or online at coopradio.org. If you have questions or feedback about this program, or want to share your story, or have something to say to us, we want to hear from you. You can reach us by email, rethreadingmadness@coopradio.org. This is Bernadine Fox. We'll be back next week. Until then.